The children's voices I hear in the background here at this clinic of this being about real people who are trying to access health care. A lot of us take it for granted. We have what we need, but there are many people out there like Amy and like the other folks that are here in the clinic today who don't have that. And that's what this is all about, is making sure that everyone, all of our neighbors, everyone in Texas, has access to the same care that most of us take for granted. I do have some prepared remarks because there's so much to say. I would probably wander off and go on, and I want to be very brief here, but I do want to make a couple of comments. Since the passage of the Affordable Care Act in 2010, Texas has stubbornly forgone the opportunity to proactively participate in improving the healthcare system for millions of Texans. We refuse to create a consumer-oriented exchange where Texans can shop for competitive insurance plans. We rejected the chance to provide any coverage for the working poor, and we left billions of federal dollars on the table, tax dollars that Texans have sent to Washington that won't be coming back to help our citizens. Thank goodness for the Affordable Care Act, because it's benefiting many Texas women, regardless of our state leadership's short-sightedness in securing even more benefits for Texans. In addition to receiving a long list of preventive services without cost-sharing copays or deductibles, beginning January 1, 2014, as you've heard, insurance policies cannot deny coverage or charge more simply because of one's gender. This is welcome news here in Texas, where the 2011 legislature cut family planning dollars by 2/3, resulting in about 147,000 Texas women losing access to preventive care. State agencies projected an additional 23,000 Medicaid births would occur, costing the state taxpayers $103 million. Fortunately, the recent legislative session appropriated funds to replace the 2011 cuts. However, the damage has been done, with close to 60, I want to repeat that, close to 60 clinics across the state having to close their doors. And with the ideologically driven decision to prohibit Planned Parenthood from participating, poor, uninsured, and underinsured Texas women lost access to a very cost-effective and efficient delivery program. Even with the infusion of restored dollars, the statewide safety net system of family planning services was decimated, and it's going to take years to rebuild. We will continue to advocate for access to health care for all Texas women, and that includes expanding Medicaid coverage through the Affordable Care Act. With the highest rate of uninsured in the country, Texas stands to benefit more than any other state by expanding Medicaid. In failing to do so, we will continue to see our emergency rooms flooded with non-emergency cases, higher property taxes due to uncompensated care, and billions of federal tax dollars that have been paid by Texans going to other states. Texas women and Texas families deserve better. Thank you.